Hello all, hope you're doing well today. Today we are continuing our conversation in chapter 8 on the trace minerals. We're talking specifically about copper, zinc, and chromium. Here we go. Copper is an essential trace mineral that plays a crucial role in various physiological processes in the body. Food sources. Good dietary sources of copper include organ meats such as liver and kidney. I'll be honest, not my favorite. Shellfish such as oysters and crab. Nuts such as cashews and almonds. Seeds such as sunflower seeds and sesame seeds. Whole grains, legumes, cocoa, and dark chocolate. Fruits and vegetables can also contribute to copper intake, although generally in smaller amounts compared to other food sources. The recommended daily intake of copper varies depending on age, sex, and life stage. For adults, the recommended dietary allowance, or RDA, for copper is typically around 900 micrograms per day. Pregnant and breastfeeding women may require slightly higher intakes of copper. Copper is involved in the formation of connective tissue, such as collagen, which provides structure to bones, skin, and blood vessels. It plays a role in the production and maintenance of red blood cells. Copper is necessary for the proper functioning of the immune system as it helps support immune cell activity and response. It is involved in the production of melanin, the pigment that gives color to the skin, hair, and eyes. Copper plays a role in the development and maintenance of the nervous system, including the synthesis of neurotransmitters. It acts as an antioxidant, helping to neutralize harmful free radicals and protect cells from oxidative damage. Copper supplementation can be beneficial in certain cases of copper deficiency or as directed by a healthcare professional. However, it's important to note that copper supplementation should only be taken under the guidance of a healthcare professional, as excessive copper intake can have adverse effects on health. Here's an overview of the potential effects of copper supplementation. Copper supplementation is commonly used to treat copper deficiency when diagnosed by a healthcare professional. It can occur in certain medical conditions or as a result of inadequate copper intake. Supplementing with copper can help restore normal copper levels and alleviate associated symptoms. Copper is involved in the formation of connective tissues such as collagen, which provides structure to the bones, skin, and blood vessels. Adequate copper intake can help support healthy connective tissue and bone development. It plays a role in supporting immune function and activity. Adequate copper levels are important for the proper functioning of immune cells and the immune response. It's also necessary for the development and maintenance of the nervous system. It is involved in the synthesis of neurotransmitters and plays a role in brain function. In cases of copper deficiency related to neurological issues, copper supplementation may be prescribed by a healthcare professional. It's important to note that excessive copper intake can have adverse effects on health. Copper toxicity can lead to symptoms such as abdominal pain, nausea, vomiting, liver damage, and impaired kidney function. It can also interfere with the balance of other minerals in the body, such as zinc and iron. Here are some prudent recommendations regarding copper intake and supplementation. Focus on consuming a varied, balanced diet that includes copper-rich foods. Good dietary sources, as we talked about, include the organ meats, shellfish, nuts, seeds, legumes, whole grains, cocoa, and dark chocolate. Include these foods in your diet can help ensure sufficient copper intake. Copper interacts with other materials such as zinc and iron. It's important to maintain a balance among these minerals. Excessive intake of one mineral can interfere with the absorption or utilization of others. You want to avoid excessive supplementation of any single mineral without proper medical guidance. If you suspect a copper deficiency or have concerns about your copper levels, it's advisable to consult with a healthcare professional or a registered dietitian. They can assess the special needs and evaluate your client's dietary habits and provide personalized recommendations based on your individual circumstances. Unless specifically prescribed by a healthcare professional, avoid self-supplementation with copper, as it can lead to copper toxicity, which can have adverse effects on health. Some medical conditions or medications may affect copper absorption or utilization. If you have any underlying health conditions or take medications, make sure you discuss the copper needs and potential supplementation with healthcare professional to ensure they align with your overall health management plan. If you have a known copper deficiency or undergo copper supplementation, regular monitoring of your copper levels through blood tests is important. This helps ensure that your copper intake and supplementation are appropriately adjusted to maintain optimal levels without exceeding safe limits. It's important to note that individuals' copper requirements can vary based on age, sex, health, status, and specific dietary needs. Copper is an essential trace mineral that plays several important roles in the body, including the formation of connective tissues, iron metabolism, and antioxidant defense. Copper deficiency can occur in rare cases, usually due to genetic disorders or malabsorption issues. While copper deficiency is relatively uncommon, its impact on health and exercise performance can be significant. Copper is necessary for the absorption, transport, and utilization of iron in the body. Iron is a key component of red blood cells and is crucial for oxygen transport and energy production. Copper deficiency can impair iron metabolism and lead to anemia, resulting in reduced oxygen delivery to tissues and decreased exercise performance. Copper is involved in the synthesis of collagen and elastin, which are important for the structure and function of connective tissues, including tendons, ligaments, and cartilage. So a copper deficiency can compromise the integrity of these tissues, leading to higher risk of injuries, joint problems, and impaired exercise performance. Copper is a cofactor for several antioxidant enzymes, including superoxide dismutase, or SOD. These enzymes help neutralize harmful free radicals and protect cells from oxidative damage. Copper deficiency can reduce the activity of antioxidant enzymes, potentially increasing oxidative stress and inflammation, which can negatively impact exercise recovery and performance. It's important to note that while copper deficiency can have significant health implications, excessive copper intake can be harmful. So the recommended daily intake for copper for adults is around 900 micrograms per day. Most individuals can obtain sufficient copper through a balanced diet with the copper-rich foods that we talked about, the organ meat, shellfish, nuts, seeds, and whole grains. Zinc is an essential trace element for living organisms, including humans. It plays a vital role in various biochemical processes and is crucial for maintaining a healthy immune system, promoting wound healing, and supporting normal growth and development. Good dietary sources of zinc include seafood such as oysters, crab, and shrimp, lean meat such as beef, pork, and lamb, poultry such as chicken and turkey, dairy products such as cheese and yogurt, eggs, legumes such as chickpeas and lentils, nuts such as cashews and almonds, seeds such as pumpkin seeds and sesame seeds, and whole grains. The recommended dietary allowance, or RDA, for zinc varies depending on age, sex, and life stage. For most adults, the RDA ranges from 8 to 11 milligrams per day. Pregnant and breastfeeding women may require higher intakes of zinc. Zinc is involved in numerous enzymatic reactions and is necessary for proper immune function, DNA synthesis, protein synthesis, wound healing, and cell division. It is crucial for normal growth and development, especially during childhood and adolescence. Zinc plays a role in taste and smell sensation. It's also involved in maintaining healthy skin, hair, and nails, and is important for reproductive health, including fertility and hormone regulation. Zinc deficiency can have various effects on exercise performance. Zinc deficiency can occur due to inadequate dietary intake, poor absorption, or increased losses. Certain populations, such as vegetarians or vegans, pregnant and lactating women, and individuals with gastrointestinal orders, may be at a higher risk of zinc deficiency. Intense exercise and prolonged sweating can also increase zinc losses. Zinc is essential for maintaining a healthy immune system. It can impair immune function, increase the risk of infections, which may hinder exercise performance and recovery. Zinc plays a role in energy metabolism, oxygen transport, and muscle function. It may also result in decreased exercise capacity, endurance, and performance. Zinc is involved in protein synthesis, which is crucial for muscle repair and recovery. Insufficient zinc levels may delay muscle healing and hinder recovery from exercise-induced muscle damage. It also acts as an antioxidant, helping to neutralize harmful free radicals generated during exercise. Inadequate zinc levels can result in increased oxidative stress, which may contribute to tissue damage and impair performance. Zinc is involved in hormone regulation, including testosterone production. Zinc deficiency can lead to imbalances in hormone levels, potentially impacting strength, muscle growth, and overall performance. It's important to note that the effects of zinc deficiency on exercise performance can vary depending on the severity and duration of the deficiency, as well as individual factors. Mild deficiencies may have subtle impacts, while severe deficiencies can have more pronounced effects. If you suspect zinc deficiency or are experiencing symptoms associated with low zinc levels, it's important to consult with a healthcare professional or registered dietitian. They can assess your special needs, evaluate your dietary habits, and conduct appropriate tests to determine your zinc status. In cases of zinc deficiency, addressing the underlying cause and increasing zinc intake through dietary modifications or supplementation may be recommended. Zinc supplementation should be done under the guidance of a healthcare professional to ensure appropriate dosage and duration. A well-balanced diet that includes zinc-rich foods such as seafood, lean meats, legumes, nuts, and seeds can help prevent zinc deficiency and support optimal exercise performance. Zinc supplementation can be beneficial in certain cases of a deficiency or as directed by a healthcare professional. However, it is important to note that zinc supplementation should only be done under the care of a healthcare professional, as excessive zinc intake can have adverse effects on health. So zinc supplementation is commonly used to treat deficiency when diagnosed by a healthcare professional. It can occur due to, again, inadequate dietary intake, poor absorption, or increased losses. Supplementing with zinc can help restore normal zinc levels and alleviate associated symptoms. Zinc plays a crucial role in immune function. Adequate zinc levels are important for proper immune system functioning, including maintaining the integrity of the skin and mucous membranes and supporting immune cell activity. Zinc supplementation may be beneficial in certain cases to support immune health, especially during periods of increased susceptibility to infection. Zinc is involved in the process of wound healing, so supplementation with zinc may be recommended in cases of impaired wound healing, such as chronic wounds or surgical incisions, to support tissue repair and recovery. Some studies suggest that zinc supplementation, when initiated early during the course of certain viral infections like the common cold, may help reduce the severity and duration of symptoms. However, further research is still needed to establish clear recommendations. It's important to note that excessive zinc intake can have adverse effects on health. Toxicity can lead to symptoms such as nausea, vomiting, diarrhea, stomach cramps, copper deficiency, impaired immune function, and an interference with the absorption of other minerals. Zinc supplementation, when used appropriately and under the guidance of healthcare professionals, typically has neutral effects on health in individuals with adequate zinc levels. Zinc supplementation is commonly used to address zinc deficiency or low zinc levels. In these cases, supplementing with zinc helps restore normal levels, which is important for overall health and various physiological processes in the body. In individuals with normal zinc levels, supplementation is generally unnecessary and unlikely to provide additional health benefits. For individuals who consume a well-balanced diet that includes zinc-rich foods, supplementation is typically not required. While zinc is involved in numerous physiological processes and plays a crucial role in immune function, wound healing, and other functions, there is limited evidence to suggest that zinc supplementation provides substantial health benefits in individuals with adequate zinc levels. In these cases, supplementation may not lead to significant changes in health outcomes. It's important to note that individual variations exist in terms of zinc requirements, absorption, and utilization. Some individuals may have specific health conditions or circumstances that could benefit from targeted zinc supplementation, as determined by a healthcare professional. And again, excessive zinc intake can lead to zinc toxicity, which can have adverse effects on health. Therefore, it's crucial to follow the recommended dosage and duration of supplementation provided by a healthcare professional to avoid exceeding safe limits. Zinc supplementation may have potential effects on exercise performance, particularly in individuals with zinc deficiency or suboptimal zinc status. However, the impact on exercise performance in individuals with normal zinc levels is less clear. Zinc is involved in various metabolic processes, including energy production. So adequate zinc levels are important for efficient energy metabolism, which can indirectly impact exercise performance. However, the specific effects of zinc supplementation on energy metabolism and exercise performance in individuals with normal zinc levels are not well established. Zinc plays a role in muscle protein synthesis, cellular repair, and antioxidant defense mechanisms. These factors are important for muscle function and recovery after exercise. In individuals with zinc deficiency, zinc supplementation may help improve muscle repair and recovery, potentially leading to enhanced exercise performance. Zinc is involved in hormone regulation, including testosterone production. Testosterone plays a role in muscle growth and strength. Individuals with low zinc levels the zinc supplementation may help restore testosterone levels and potentially have positive effects on muscle strength and exercise performance. Again, it's important to note that the effects of zinc supplementation on exercise performance may vary depending on individual factors, including baseline zinc status, dietary zinc intake, and overall health. Additionally, it's worth mentioning that the current scientific evidence regarding the direct effects of zinc supplementation on exercise performance in individuals with normal zinc levels is limited and inconsistent. Some studies suggest potential benefits while others show no significant effects. Here are some prudent recommendations regarding zinc intake and supplementation. Focus on consuming a varied and balanced diet that includes zinc-rich foods. Good dietary sources of zinc include the seafood, lean meats, poultry, dairy products, eggs, legumes, nuts, seeds, and whole grains. Including these foods in your diet can help ensure sufficient zinc intake. The recommended dietary allowance, or RDA, for zinc varies depending on age, sex, and life stage. For most adults, the RDA ranges from 8 to 11 milligrams per day. Pregnant and breastfeeding women may require slightly higher intakes. If you suspect a zinc deficiency or have concerns about your zinc levels, again, it's advisable to consult with a healthcare professional or registered dietitian. They can assess your specific needs, evaluate your dietary habits, and conduct appropriate tests to determine your zinc status. Zinc supplementation should be considered only when there is a confirmed zinc deficiency or as recommended by a healthcare professional. Self-supplementation without medical guidance is not recommended, as excessive zinc intake can have adverse effects on health. If zinc supplementation is prescribed, it is important to follow the recommended dosage by the healthcare professional. Taking more than the recommended dosage can lead to zinc toxicity and other health issues. Some medications or medical conditions may interact with zinc and affect zinc absorption. If you have any underlying health conditions or are taking medications, discuss your needs with potential supplementation with your healthcare provider to ensure they align with your overall health management plan. Regular monitoring of zinc status through blood tests is recommended, especially if there is a known zinc deficiency or undergoing zinc supplementation. This helps ensure that your zinc intake and supplementation are adjusted accordingly to maintain optimal levels without exceeding safe limits. Chromium is an essential trace mineral that plays a role in various metabolic processes in the body. The recommended dietary intake for chromium varies depending on age, sex, and life stage. For adults, the adequate intake level is typically set at around 20 to 35 micrograms per day. And you can see it changes with adult males, it's about 35 milligrams versus with females, it's about 25 milligrams. Good dietary sources of chromium include whole grains such as whole wheat, barley, and oats, as well as broccoli, green beans, nuts, especially Brazil nuts, brewer's yeast, and some spices like cinnamon. Chromium is involved in carbohydrate, fat, and protein metabolism, particularly in the regulation of insulin and blood sugar levels. It enhances insulin sensitivity, which is important for glucose uptake and utilization by cells. Chromium may also play a role in lipid metabolism and the regulation of cholesterol levels. Chromium deficiency is rare, as the body requires only small amounts of chromium for optimal health. However, when deficiency occurs, it can have potential effects on health and consequently sport performance. Chromium plays a role in regulating insulin and maintaining normal blood sugar levels. Chromium deficiency may result in impaired insulin function, leading to difficulties in blood sugar control. This can affect energy metabolism and potentially impact sport performance, particularly endurance and high-intensity activities that rely heavily on glucose as a fuel source. Chromium deficiency can contribute to reduced insulin sensitivity, making it harder for the body to efficiently utilize glucose. This can impair glycogen synthesis, glucose uptake into muscle cells, and overall energy availability during exercise. Chromium deficiency may affect lipid metabolism and cholesterol regulation. Studies have suggested a link between chromium deficiency and alterations in lipid profiles, including increased total cholesterol and LDL cholesterol levels. Disturbances in lipid metabolism can impact cardiovascular health and potentially affect sport performance. Chromium is involved in protein synthesis and muscle repair processes. Deficiency may hinder muscle recovery and lead to delayed healing of exercise-induced muscle damage, potentially affecting strength, endurance, and overall sport performance. It's important to note that chromium deficiency is typically associated with specific medical conditions or situations that affect chromium metabolism, such as certain medications, poorly balanced diets, or malabsorption disorders. Inadequate dietary intake of chromium alone is rare. Chromium supplementation is generally not necessary for individuals with a well-balanced diet, as chromium deficiency is rare. Most people can obtain sufficient amounts of chromium through their regular food intake. If you have been diagnosed with chromium deficiency through blood tests and under the guidance of a healthcare professional, chromium supplementation may be recommended to restore normal chromium levels. Chromium has been studied for its potential role in improving blood sugar control and insulin sensitivity, particularly in individuals with impaired glucose metabolism or type 2 diabetes. In such cases, chromium supplementation may be considered as part of a comprehensive management plan under the guidance of a healthcare professional. It's important to note that the following regarding supplementation of chromium. Chromium supplementation should only be undertaken under the guidance of a healthcare professional. They can assess your specific needs, evaluate your health status, and determine if supplementation is necessary and appropriate. If chromium supplementation is recommended, it is crucial to follow the recommended dosage provided by your healthcare professional. They will consider your individual needs and health condition to determine the appropriate dosage. Chromium supplements may interact with certain medications such as insulin, or medications for diabetes and can potentially affect their efficacy. It's important to inform your healthcare professional about any medications you are taking to ensure compatibility and avoid potential interactions. Regular monitoring of your chromium status through blood tests is important to assess the effectiveness of supplementation and adjust the treatment plan if needed. Ongoing evaluation by a healthcare professional is crucial to ensure appropriate dosage and monitor any potential side effects. As mentioned earlier, chromium is an essential mineral that plays a role in various physiological processes in the body. It is commonly found in small amounts in foods such as meat, whole grains, fruits, and vegetables. Supplementation has been studied for its potential effects on health and exercise performance, particularly its role in glucose metabolism and weight management. However, the evidence regarding its benefits is mixed, and it's important to consider individual factors and consult with healthcare professionals before starting any supplementation regimen. Chromium is involved in insulin signaling and may enhance insulin sensitivity, potentially improving glucose metabolism. Some studies suggest that chromium supplementation may be beneficial for individuals with impaired glucose tolerance or type 2 diabetes. However, the overall evidence is not conclusive and more research is needed to establish the effectiveness of chromium supplementation for glycemic control. Chromium has been proposed to have a role in appetite regulation and weight management. Some studies have suggested that chromium supplementation might help reduce food cravings and improve satiety, leading to potential weight loss benefits. However, the evidence is limited and the effects of chromium on weight management are not well established. There is limited evidence to support the notion that chromium supplementation directly enhances exercise performance. While some early studies suggest that chromium supplementation may increase lean body mass and reduce body fat, more recent research has failed to consistently demonstrate these effects. Furthermore, chromium's role in exercise performance is likely to be influenced by various factors such as diet, training, regimen, and individual variability. It's important to note that excessive chromium supplementation can have adverse effects, including gastrointestinal upset, skin reactions, and potential interactions with certain medications. The recommended daily intake of chromium for adults is around 20 to 35 micrograms per day, and most individuals can obtain adequate amounts through a balanced diet. In conclusion, while chromium plays a role in glucose metabolism and there have been claims of its potential benefits for weight management and exercise performance, the evidence is not strong enough to make definitive recommendations. It's also always best to prioritize a well-balanced diet. Fluoride is a mineral that is commonly known for its role in promoting dental health. It is naturally present in various sources, including soil, water, and certain foods. It plays a crucial role in preventing tooth decay and promoting dental health. It helps in strengthening tooth enamel and makes teeth more resistant to acid attacks caused by bacteria and sugars in the mouth. Fluoride is often added to toothpaste, mouthwashes, and community water supplies as a preventative measure against tooth decay. Regular exposure to fluoride helps prevent cavities by inhibiting the demineralization of tooth enamel and promoting its remineralization. Fluoride can also disrupt the metabolism of bacteria and dental plaque, reducing acid production and inhibiting the growth of harmful bacteria. Many communities add fluoride to their public water supplies to provide a consistent and controlled level of fluoride for dental health benefits. Water fluoridization has been recognized as one of the most effective public health measures in preventing tooth decay, especially in areas with limited access to dental care. In addition to fluoride in water and toothpaste, topical fluoride treatments such as fluoride varnishes or gels can be applied by dental professionals. These treatments are often recommended for individuals at higher risk of tooth decay, such as children or individuals with certain medical conditions. Excessive fluoride intake during tooth development, primarily in childhood, can lead to a condition called fluorosis. Mild fluorosis usually appears as barely noticeable white streaks or spots on the tooth enamel. Severe fluorosis, although rare, can result in brown discoloration and pitting in the enamel. The risk of fluorosis is minimal when fluoride is used appropriately as recommended by dental professionals. The optimal level of fluoride intake varies depending on factors such as age, body weight, and the fluoride content in water and other sources. It's generally recommended to follow guidelines from reputable dental and health authorities regarding fluoride intake and dental care. It's important to note that fluoride needs can be met through various sources, including fluoridated water, toothpaste, and professional dental treatment. Iodine is an essential trace mineral that is vital for the proper functioning of the thyroid gland and the synthesis of thyroid hormones. Iodine is a crucial component of thyroid hormones, namely thyroxine, or T4, and triiodothyronine, T3. These hormones play a critical role in regulating metabolism, growth, development, and the functioning of various organs and systems in the body. Adequate iodine intake is necessary for maintaining optimal thyroid health. A deficiency in iodine can lead to thyroid disorders such as goiter, which is enlarged thyroid gland, or hypothyroidism, which is underactive thyroid, which can result in symptoms like fatigue, weight gain, cold intolerance, and cognitive impairments. Iodine is particularly important during pregnancy and early childhood for proper brain development. Adequate iodine intake by pregnant women ensures the availability of iodine for fetal brain development, such as thyroid hormones are critical for normal neurological growth and cognitive function. Iodine deficiency is a significant public health concern in some regions. To address this, iodine is often added to table salt in the form of iodized salt. Additionally, in areas where iodine deficiency is prevalent, iodine fortification programs are implemented to ensure sufficient iodine intake through staple foods like bread, dairy products, or salt. The recommended iodine intake varies depending on age, sex, and life stage. For adults, the recommended daily intake of iodine is approximately 150 micrograms. Pregnant and breastfeeding women may require higher intakes to support the needs of both the mother and the developing fetus or nursing infant. Good dietary sources of iodine include iodized salt, seafood such as fish, shrimp, and seaweed, dairy products, eggs, and some fruits and vegetables that are grown in iodine-rich soil. It is important to note that excessive iodine intake can also have adverse effects. In some cases, excessive intake can lead to thyroid dysfunction, autoimmune thyroid diseases, or iodine-induced hyperthyroidism. Therefore, it is crucial to aim for an adequate but not excessive intake of iodine. Trace minerals, also known as trace elements, are minerals that are required by the body in small amounts for various physiological processes. Here's some examples of trace minerals and their roles in human metabolism. Molybdenum is a cofactor for several enzymes involved in the metabolism of amino acids, purines, and sulfites. Iodine is necessary for the synthesis of thyroid hormones, which regulate metabolism, growth, and development. Fluoride is also known for its role in dental health, helping to prevent tooth decay. It strengthens tooth enamel and makes teeth more resistant to acid attacks from bacteria and sugars. These are just a few examples of trace minerals and their roles in human metabolism. Each mineral has specific functions and is required in varying amounts. It's important to maintain a balanced diet that includes a variety of nutrient-rich foods to ensure an adequate intake of trace minerals. If you have specific concerns about your trace mineral status, it's best to consult with a healthcare professional or registered dietitian for personalized guidance. Trace minerals are involved in a wide variety of physiological functions in humans, and a trace mineral deficiency may lead to adverse health effects. Supplementation with trace minerals will have no beneficial effects on health or physical performance except in cases where deficiency is corrected. Iron deficiency, particularly among women and young children, is a major nutritional health concern. So, iron-rich foods such as lean meats and beans should be stressed in the diet. Iron status is important to aerobic endurance athletes because Insufficient hemoglobin or other factors associated with iron deficiency may impair performance. Athletes may have poor iron status due to inadequate dietary iron and increased loss of iron in the urine, sweat, and feces. Iron supplementation may improve performance in individuals with iron deficiency anemia, but not in individuals with normal iron status, although individuals who have iron deficiency without anemia may experience less favorable responses to aerobic training. Findings from studies are equivocal as to the efficacy of iron supplementation to improve performance, and investigators recommend additional research. Athletes who train at altitude may consider iron supplementation. Zinc deficiency has been shown to impair the growth process in children, so it may be a problem for young athletes who incur heavy sweat losses and are on low-calorie diets, such as wrestlers, dancers, or gymnastics. Chromium supplements have been marketed to increase muscle mass and decrease body fat, but research does not necessarily support those claims. There does not appear to be much valid scientific evidence to support an ergogenic effect of trace mineral supplementation, including zinc, copper, boron, selenium, vanadium, and manganese. And that is all that I have for you today. I look forward to talking with you again. Have a great day.